Hi, I'm Dr. Rob Zambrano, and I'm the Clinical Director for Stress and Anxiety Services of New Jersey. And today we're going to talk about why we don't use relaxation during exposure and response prevention. So, exposure and response prevention is one of the main tools that we use in dealing with OCD and anxiety disorders, and it involves facing your fear. So, for example, if you're afraid of coming in contact with something that you think is contaminated, we might have you touch that item and delay washing your hands. Um, or if you have a superstitious belief, for example, not tapping your nose 3 times might cause something bad to happen, I would have you think about that bad thing and not tap your nose. So this is what we call exposure and response prevention. You're exposing yourself to the thing you're afraid of, and you're preventing yourself from engaging in some kind of compulsive behavior aimed at suppressing your anxiety. Now, the reason that we don't do relaxation during exposure and response prevention is the very point of ERP is for a client to learn how to manage their anxiety more effectively. And so relaxation can become a form of avoiding anxiety, right? And therefore, we are denying someone the opportunity to prove to themselves, I can handle these bad feelings, that these bad feelings are temporary and manageable. In fact, there's some research that shows that when we do relaxation during exposure therapy, it actually delays the process of habituation and gets in the way of our clients learning that they don't have to do anything to make the anxiety go away, rather than just learn how to accept it and experience that it will fade away on its own. And at the end of that experience, one of my favorite things to ask a client is, what did you learn from this experience? And very often they tell me that my anticipation of the event was far worse than the actual event. Or they might tell me, I learned that even though that was difficult, I could get through it. And often, in the best case scenario, someone will tell me at the end of the experience that although it was uncomfortable, because I didn't avoid my anxiety, I experienced desensitization or habituation, which is where we get used to the uncomfortable feeling, and it slowly fades away. And that's a really powerful tool for our patients to learn, because what they can see is they don't have to avoid engaging in normal behavior. They don't have to alter the choices they make just because their intrusive thoughts tell them that they won't be able to manage the discomfort that comes with doing the uncomfortable thing. And I like to explain to clients that it's actually an act of courage, that being courageous doesn't mean doing something and not feeling afraid. It means being willing to be afraid and doing it anyway, so that OCD and other forms of anxiety don't take away our ability to live a normal and meaningful life. I hope that was a helpful explanation, and have a great day, everybody.